Hello all, this is Dr. Lalita Shri Mukunda from Department of Pathology, Narayana Medical College, Hospital, Nellore. Today I am going to speak about World Marrow Donor Day. World Marrow Donor Day is celebrated globally on 3rd Saturday of September every year. The main objective of World Marrow Donor Day is to thank all the marrow and stem cells donors worldwide. These donors could be family members of the patients, relatives, compassionated unrelated donors, cord blood donors, donors who have already donated, new donors who have registered in the global registry of marrow donor and are waiting for their turn to donate. The second objective of World Marrow Donor Day is to raise awareness among the general public, healthcare professionals, policy makers and researchers about the importance of stem cell donor and the impact of blood stem cell transplantation in patient's life. With these two objectives in our mind, there are few questions which arises in our mind regarding marrow donation and transplantation. What is marrow? What are blood stem cells? Which patient is benefited from transplantation of marrow? What are the indications of bone marrow transplantation? Who can become a donor? Does marrow donation have any adverse effect? Marrow is a reddish yellow spongy tissue present within bone. It produces more than 200 billion new cells every day of red blood cells, white blood cells and platelet lineages. Multipotent hematopoietic stem cells are adult stem cells which have the capacity to replenish into blood and immune cells. The sources of hematopoietic stem cells are bone marrow, peripheral smear by induction, umbilical cord blood, placenta, fetal liver and embryonic stem cells. Indications for bone marrow transplantations: malignant bone lesions like multiple myeloma, acute myeloid leukemia, chronic myeloid leukemia refractory to tyrosine kinase inhibitor and malignant lymphoma. There are several non-malignant lesions involving marrow. They are aplastic anemia, Fanconi's anemia, paroxysmal nocturnal hemoglobinuria and several immune deficiencies. Often a bone marrow transplant is the person's best possible survival and possible cure. The bone marrow transplant replaces the diseased bone marrow with a healthy tissue. The stem cells are found in blood. That is why the bone marrow transplant is also called stem cell transplant. Coming to the types of transplant, there is autologous transplant, taking your own stem cells. For this procedure called apheresis is done to collect the stem cells, and then there is an allogenic transplant where the stem cells are collected from the donor. For this we need a donor. Who can become a donor? A donor should be 18 to 60 years age with good health and ready to donate for the patient who is in need. A pregnant woman aged more than 18 years without any complication should register well in advance for cord blood donation. No adverse effect of marrow donation is noted. The marrow comes back to its normal state within 5 to 7 days after donating. A good news is that bone marrow donation is as easy and as painless as you donate the blood. World Marrow Donor Day is supported by two international organizations. They are World Marrow Donor Association and European Society of Blood and Marrow Transplantation. World Marrow Donor Association consists of 75 hematopoietic cell donor registries from 53 countries, 53 cord blood banks from 36 countries. But still we need more donors because 40% of the patient are yet to find HLA matched donor from the global registry. Theme for World Marrow Donor Day 2025: give someone second chance at life. The theme speaks about the impact of donation, which gives patient second opportunity to live full life. In India, bone marrow donation yet to pick up the pace. Thank you.